I'm sitting here with Keith Kloos. We were just talking a little bit about all kinds of things that are going on in recovery right now in the addictions world. It's a really hot topic right now. A lot of people suffering, and it's important that we're talking about this topic. So thanks for coming on, man.
Hey, thank you so much, Steve. Thanks for having me, man. I'm really glad to be here.
Yeah, man, I appreciate you coming. And, you've done a lot of stuff. You've been doing this for quite a while now. How long have you been working in the field of addictions?
I've been doing this for about 6 years.
Okay.
I really dove into it. I started volunteering, early on, just kind of learning the ropes, seeing what worked, what didn't work, kind of taking from my own personal experience of how much trouble I had in the past trying to get treatment, and realizing, how much trouble it is for some people, especially the uninsured, to be able to find treatment.
Yeah, people have a tough time accessing care, and that's one of the hardest things, I think, to kind of get your head around is, someone suffering with the disease of addiction. First of all, there's that huge stigma. I mean, we could go in a million different directions. We can go down a rabbit hole in one way or the other. But there's a whole bunch of different directions here. But people finally get to that point where they're ready to change. They're ready to do something. And then what happens?
They have to wait.
Man.
And that's the biggest obstacle, I have today. I'll get a call, guy's ready to go, he's finally ready to get treatment, then we have to dive into what's your insurance, and then kind of, pick that apart. And, when they say Medicaid or non-insured, automatically I know that they're going to be waiting at least a week. And
so at least a week, which is an eternity when someone's like, so what can happen in that week? I mean, that's the big thing. I mean, we've seen people that, don't make it, it takes it's kind of a long time when you're looking at someone who's suffering with the disease, because they're not, they're ready right then and there.
Yep.
If you wait a half hour sometimes, it could be
10 minutes,
the difference between them coming in or not.
Yeah.
And then, unfortunately, the effects can be devastating.
Yeah, that gap of motivation is it's very small, because it's usually, they're pinned against the wall, maybe legal issues, whatever it may be, and, they're really trying to finally buy into what treatment is. And then, us to be able to explain to them that, it's not there just waiting for you. You need to go, really seek it. And, I have a story of my own. I for some reason, every time I was ready to go to treatment, I didn't have insurance by that time.
Okay. Yeah. So you had insurance, and then when you're finally ready to do something, of course, at that point you burn a lot of bridges, and maybe you're not working anymore. That's the kind of the progression that it goes in. So, you get to that point where you're ready, and then
it's gone. And it's like, okay, man, if this was a month ago, I'd be good to go to somewhere really nice or something like that. And then I'm told, all right. And back then we didn't have something like the IME hotline or any of these.
That's fairly new.
Yeah,
it's fairly new.
Since Christie kind of stepped up and did a few things, he, setting Chapter 28 and all that kind of stuff. But back when I was trying to seek treatment, you actually had to go. First, you had to call your local assessment agency. Then you would go there. You would wait about 4 to 5 days for an appointment for that. Then you would go there, and then they would assess.
If you made it there. If you made it there, because a lot of times people don't.
They would assess you and tell you if you're available for funding, and then you would be put on the wait list for a treatment center.
Okay. And how long was that?
About 3 weeks.
3 weeks.
So the whole process took anywhere from 3 weeks to a month.
Okay. And how long ago was that? When was that about?
This was about 2008, 2009.
Okay. So not that long ago. You're talking about 10 years ago.
Yeah.
That's not that far away.
No, not at all. Yep.
Okay.
And I remember one time I went into a treatment center and just waited in the lobby and wouldn't leave until they took me.
I'm not going anywhere. Did they call the police on you?
They actually took me in.
Okay, good for them.
I don't suggest anybody else doing that.
Yeah, that's probably a bad idea in most cases, but you get desperate, right?
Yeah.
Look, I'm ready to get help. I want to get help, and nobody's helping me.
Yeah, absolutely.
Do you think things have gotten better?
Absolutely, especially in the last 2 to 3 years. I noticed. I remember when I really first started working in this, about 6 years ago. It was just very difficult to do anything or navigate the system.
Yeah.
We actually sat down with a whole bunch of people and just picked it apart and said, how does the system even work? Or how doesn't it work? And really trying to figure out how we can access treatment or help people access treatment. And now, the last 2 years, things have gotten significantly easier.
So the wait list is smaller now. I mean, it still has a lot of issues.
Yeah.
I mean, there's still, I work in the field as well, and you know that. We still have difficulty, sometimes getting people in the timely manner that they need because, we have expanded addiction treatment in the system, but we don't really have the expanded access or beds.
There's not enough beds.
Yeah, that's basically what you run into, and that's you got a bottleneck going on where people are looking for help, they're trying to get it, and as well as I do, we talked about it before, you got to strike while the iron's hot. If they're not ready to, if they're ready, you got to call them, get them in, get them going, get them in a car, get them to where they're going because you don't have a whole lot of time before they probably change their mind and maybe don't want to go.
Absolutely.
Because it took a whole lot for them to get there. It's a hard thing to ask for help.
Yeah.
It's a hard thing. And especially, you got pride, you got all that other stuff. People generally have to get to that point where it's, oh man, I got no other alternative. I need to seek something out, seek out some kind of change in my life.
Absolutely. Yeah, and the pride thing, that's every addict's defect, So, when it comes to that point and, just speaking from my own personal experience, the last thing I ever wanted to do was ask for help. It always took me to the very last stand, per se, is the back against the wall, ready to either become incarcerated or had 2 pennies left in my pocket, until I was like, okay, now I'll go.
I got no other alternative. My back's, I'm totally, spiritually bankrupt and, and beat up out here, and someone once said, when the pain becomes great enough, we begin to change.
Absolutely.
So when it hurts enough, you get to that point where you start to say, I got to look at my options. And we also associate, I don't know if you're anything like me, but I associate a lot of times, with asking for help with like people determining, saying that thinking you're weak, and that's and it's a hard thing to get around, and that doesn't mean, asking for help. Everybody needs help. I've never met an addict or an alcoholic that didn't need help getting sober. Absolutely. Now that help may look different for a lot of different people because everybody recovers differently, but everybody needs help. I mean, I've yet to meet that person who's just said, hey, you know what? Who's gotten to the point where they're diagnosable as with addictive illness or substance abuse disorder, as we call it these days, and gotten to that point where they've needed, the degree of help that they would require, and have been able to just say, you know what, I'm going to tough it out, willpower this out, and do it on my own. But we've tried. I've known many addicts have tried to, thinking that they're unique in some way to, be able to just somehow, when all these other people couldn't do it, they're the one who can. And, I always tell people, you may be right, but what if you're wrong? What are the consequences? And, I call it terminal uniqueness. There are people that I've met that were so unique that they wouldn't get help or get into a program. They thought they could do it on their own, and they're not here anymore.
Yep, absolutely. I went to 31 funerals last year.
Wow.
And that's heavy on anybody's heart.
That's a lot.
And a lot of these were friends I grew up with, guys I grew up with, people that I've helped over the last, year or so or couple years. And, it's just a tough pill to swallow, and just to see what actually, just not asking for help or not buying into recovery altogether, because a lot of people, I know for myself as well, I went into the rooms thinking they were all lying. You know, these people, they're
not sober.
They're really getting drunk on the weekends, and they found some way to
They figured out some way to make it work. Yeah. No, I hear you.
Yep, and I just didn't find that magic pill out yet. You know, maybe I could just use on weekends or whatever it may be. And
how come they're not sharing a secret with me?
Yeah.
What is it that they know that I don't?
Catching a resentment. That I didn't know was going on. But, you know, it just took a lot of time to understand that, you know, what this process is and, you know, the pain that is associated with getting that motivation. You know?
There's a lot of, you know, it's tough. It's tough.
And one thing, you know, I think we've taken a step back with is, you know, we've really softened the blow in some kind of sense, you know, by decriminalizing everything. You know, I don't think anybody should be incarcerated for a long period of time, but also just having them come in and giving them a ticket and letting them go back right out to the street isn't a good solution either. Yeah,
there has to be something in between.
Yeah, some kind of consequence where we can get them back on track and get them the help they need. You know, a lot of these police departments now are starting to, you know, get involved in the community with addiction, and they're finding it difficult because they can't hold the patient long enough for a recovery coach or anybody to come and see them.
To even get them there, because they're just like, I want to get out of here.
I want to go.
Yeah. And that's the thing. I think we need some legislation. I agree. I think we need some legislation to kind of, when someone gets into a situation where the police are involved and they're an addict, there has to be some in-between ground. You know, it's not like, okay, I'm going to write you a little ticket, show up in court. They're not going to show up in court.
Never.
You know, I had one addict tell me, judge always tells me, or the police, they always write me something and send me on my way and tell me to show up in court. And, you know, and they're like, you're going to show up in court, right? He's like, yes, I am. And they generally don't see him until they catch him later on, usually with a warrant because he didn't show up in court. And then he ends up incarcerated for a period of time. And, you know, the legal system's full of people who are in jail for all kinds of, you know, charges related to addictive illness. And, there should be some kind of, you know, if someone gets caught with some, you know, with drugs, depending on the drug, I mean, there's different things. I mean, different levels. I mean, you're talking, you know, there's a big debate right now about the marijuana and making it legal in New Jersey. And quite honestly, I'm like, you know what? Whatever it's going to be, it's going to be. I mean, I don't, you know, alcohol's legal, and you know, I mean, someone said to me the other day, and in no way am I for or against it. I am not. But someone said to me the other day, you know, people get drunk on alcohol and go start a fight. People get drunk on or get stoned on pot and they start a band. So I don't know. But you know, where I kind of get off the bus with that is looking at it as a treatment for opioid addiction. I've seen that come out. I don't think that's a viable solution. I think the statistics that they've pulled out to try to justify that are badly flawed.
Oh, yeah, absolutely.
You know, by saying states that have legal marijuana have less opioid addiction.
Yeah, no way.
It was like that before.
Absolutely. And most of us probably already tried that way if we're in the rooms of AA or NA. I know I did. You know,
the marijuana maintenance plan.
Yeah. You know, I'm only going to smoke pot and I'm not going to touch, you know, before any addictive substance, and I know this for myself, any addictive substance that goes into my body eventually is going to destroy me. You know, whether that's getting me back to the original substance that destroys me, you know, in the end, but it just starts off with one drink, one joint, you know, and before I know it, it's back to the races. So, you know yourself, you know, and
you know you better than I know you because you've been with you longer.
Exactly.
So it's kind of that's the philosophy behind that. But I mean, you know, there are plenty of people out there who can go out and have a few drinks and be fine. And not ruin their lives. You know, that's most people, the majority. And then, you know, and I'm sure there's the same thing with, you know, marijuana and other different types of substances. There are people that can actually go out and do different things. Should you? I don't know. I mean, that's not my, you know, I know for me, I'm a recovering addict as well. I know for me that doesn't work.
No.
And that's the thing. Once you get to that point where you know where your life goes, you know, I have a friend of mine who says, you know, hey, I'll go out and get drunk, but we're going to jail. That's kind of what, you know, he knows it. He knows, you know, before he picks up that drink, he knows that this is not going to end well.
Yeah.
And that's somebody who's been, you know, who's been to that point where they're, you know, been to the bottom of their addiction. They know, you know, and like I said, a lot of them have been unraveled by trying it. I mean, I've seen plenty of people get like 10, 15 years sober, start doing some, you know, say, hey, I can go out and have a drink now, and end up back where they were, or worse, or much worse.
Yeah, usually ends up almost worse too, because and you know, this was every relapse I had was, you know, it always ended up being way worse than it was originally, you know, and I don't know if that was because, you know, it was just that the progression, which most likely that's what it was. But you know, I remember always thinking like, okay, well, I'm in NA, so I can just drink, and I just won't touch the drugs anymore. And
you missed that whole point about alcohol is a drug, right?
Yeah, totally blacked that one out, you know. And before I knew it, it ended up, and it happened to me. I did the whole cycle in one night. You know, I went to the bar, I had a couple drinks, and before I knew it, I was with my substance of choice by the end of that night, and ended up using for another 2 months before I ended up back in treatment, you know. And it was like, you know, I had a job at the time, I had all that kind of stuff that I rebuilt, and it was like, man, over a drink, you know, and I can never really make that connection.
One is too many, and 1,000 is never enough, right? That's what we say, right? So, and that's not just something we say; it's been proven
over and over,
over again. And we have a real difficult time getting there sometimes. It's
the
like
insanity.
Yeah,
you know?
well, somehow you're different.
Yep.
Somehow that's like goes back to that terminal uniqueness I was talking about. Is somehow, in some way, you think you're going to be able to do this when so many have not been able to, and that's a hard lesson to learn, because it can have serious consequences. I mean, you hear the stories all the time about someone who goes back out and relapses and ends up drinking and driving or something like that, and killing somebody.
Yes, absolutely.
Waking up in a prison cell, not even knowing what happened, and have to be told, you know, that you just, you know, you killed somebody in a car accident, and then you got not only the guilt of that, but you got the legal stuff, and you know, I can't even imagine. I can't even imagine what that would feel like. So, I mean, there's some serious consequence, and it's a split second.
Just like that, you know, and that one thought, and really trying to, you know, and tech, you know, it's all about the techniques, and I think recovery, you know, is really learning those techniques that work for you. You know, those daily things that help you through, you know, the most stressful moments, or even the best moments in life. You know, because I wasn't always that type of person that used over just because things were going wrong. Most of the time, it's because
when things are
going
great.
right, you know, and it was
things
like,
are going good. I need to celebrate.
Exactly, that's celebratory user. You know, I would get a raise, or something would go really good for me, and I would have that thought, like, you know, go treat yourself. You've been so good, you know, and before I know it, everything was destroyed again. You know, so it's really dealing with those thoughts and saying, well, you know, is me going, you know, in the middle of Camden or middle of Trenton and going, picking up some drugs, you know, treating myself? You know, no, it's not.
No.
You know, and
not at all.
If anything, it's, you know.
But in your mind at the time, it was, you know, it's that delusion that you carry, you know, that processing error that we have, you know. I mean, a friend of mine, and I talk, you know, because I hear a lot of people talk about a lot of things related to this, and you know, one thing that he always says is, you know, I'd pass a bar. He said, I'd pass a bar. And then he'd start thinking, you know, because he was a coke addict and did a whole bunch of, all kinds of other crazy stuff. But, and he had to go to prison and all that other stuff to get well, like so many do. You know, they have to go down that road, and, you know, not everybody has to go there, but, you know, some do. And he says, I'd pass a bar and I'd be sober. And he says, you know, and then all of a sudden I'd start thinking in my head, like he visioned it like a commercial, you know, like one of those beer commercials where he's going to go in, he's going to have a drink, and everything's going to go great. there's going to be girls, and he's going to be, you know, just having a party, and it's going to be a good time, and he's going to go home with a girl, and that's going to be the, you know, great night he's going to have, and that's going to be the end of it. Yeah. And the reality of that was he'd go into the bar, he'd have a drink. He would sit there, he said, I'd sit there like a serial killer, nobody talking to me, by myself, drinking, and then he would just have another one, and then he'd be doing shots, and then he would say, to hell with this, he'd go get some Coke, then he'd be, you know, and the next thing he knows, he's at the, you know, the Black Horse Pike in where's that, Atlantic City, in some nasty hotel 3 days later, still doing Coke. Yeah. You know, and that, hating himself for doing it. Yeah. Crying at the same time while he's taking that hit off a pipe, you know. Yeah. You know, someone once said addicts use against their will. Mm-hmm. They don't use because they want to use. They use because they have they feel they have no choice. They use, it's like being a hostage. Yeah. You know, it's being in a hostage situation. You're using against your will. So when someone says to me, just use your willpower. Yeah. It's like, okay, you ever try to willpower away a case of diarrhea? Yeah. Doesn't work. Try that next time.
I wish I thought about that the first 15 times. You know? It's
like, just use your will. Yeah, you hadn't thought about that, right? Yeah. No, I get it. And, you know, it's that crazy dynamic that happens. And, you know, that distortion, that cognitive distortion that we have when we say, okay, this is how it's going to be, right? Same thing with heroin addicts. I'm going to use one bag. You know, I've been sober for 3 days. As long as I don't use for 3 days in a row, I'll be good. Generally, that doesn't work. No. You know, they're back in treatment, or worse, or they don't make it back in treatment, which also happens. I mean, we've both known a lot of people who've come through treatment, who've you know, tried to get sober and just didn't make it.
Yeah, well, you know, I was just looking at, you know, there was been some stats flowing around that's saying anywhere from 70 to 85% of the heroin out there on the streets right now is cut with fentanyl. Mm-hmm. You know, so most likely, you know, if you were to go out and try to get a bag of heroin right now, you know, most likely it's going to have fentanyl. Oh, yeah. Yeah. You know, and for somebody saying that maybe has a year clean or 6 months or any clean time at all, goes out and uses just one bag, it could kill him. It's deadly.
It could kill him. Yeah. You know? No, and that's the thing. And you know, well, it's not funny, but the interesting thing behind that is, you know, we're talking about this like it's new. Mm-hmm. Right? Yep. The opioid epidemic itself is not new. It's been going on for a long time. It's slowly made its way. I could pull up a map that can show, and I'm going to actually follow up with this podcast with something else that's going to kind of give a little bit of a presentation on some of the stuff we're talking about. But, you know, I could pull up a map that shows the progression since 1990 of the opioid epidemic. And people started noticing basically when it moved out of the inner cities, and the suburban kids are dying from it. Yep. And the you know, and now it becomes a problem. Yeah. You know, unfortunately, that's how we think. You know, now it's a problem because the soccer mom with the soccer ball on her truck's driving around stoned on heroin. You know, while she's driving her kids around. That's when we decide it becomes a problem. The fentanyl issue, I'm going to tell you, I got sober in 2002, and it was in it then. Yeah. There was fentanyl in heroin then. You know, because I specifically remember a doctor telling me that. Like, dude, you know, and that was way before 2000. That was probably 2-3 years before I got sober. I was in treatment at one point because I'm not a first-time winner. Yeah. A lot of people aren't, you know. And I'll tell you what, I remember a doctor saying, you know, if I test you for fentanyl, you're going to come up positive because everything has fentanyl in it now. Yeah. At least minute traces of it, but it was there. So it's nothing new. Fentanyl's been around. What is new is the new carfentanil that's out there, or the Gray Death, which is a great name, by the way. It kind of should tell you right there where you're going with that. But, you know, these drugs are so powerful. Yeah. They have really no real use in human consumption at all. And, you know, they kill people on a regular basis. I mean, it's like, you know, and that's the thing. When you're going out there buying stuff off the street, you don't know what you're getting. These guys, I tell people all the time, they're not
chemists.
Your dealer's not sitting in a sterile lab with sterile clothes and gloves and a mask and all this stuff on, you know, mixing your stuff up right, making sure it's just right. No, they're sitting in some back alley crap place with some, in some seedy motel or something,
scooper, and
with a couple playing cards, trying to figure out what and just throwing it all together and saying, yeah, it looks right.
Absolutely.
And you know what, now, and the thing is, if you die from it, that's good for their business.
Yeah. People.
I'm sorry, it's just how it's the business model they're operating under. They don't want you to, but if you happen to, because I don't know, for anybody who doesn't know out there, that the heroin bags come with stamps on them. Now, if you hear a certain, and this was going on even when I was using, man, if somebody said, there was a type of heroin out back then called body bag, it was killing people.
Yep.
And everybody was looking for it.
Yeah. And it was called body bag.
It was called body bag. I mean, that should say enough right there.
Yeah.
But everybody out there was trying to get this body bag because, hey, it's killing people. It must be good.
Mm-hmm. Yeah, it must be.
Nobody's thinking for a second that this is some tainted stuff that can kill you.
Yep. Absolutely.
Nobody was even in that area. I'll just do a little less.
Yeah.
That
was the same with us too. Back then. When I was using, everybody would go, looking for that kind of stuff. And I got people right now that I'm actually working with, and I have two guys out there right now waiting for treatment. Non-insured Medicaid, and they're getting there. Probably I'll be able to get them in by Monday, Tuesday. Okay. But they actually
hope they make it.
I hope they make it.
Yeah,
I've lost
scary.
people waiting for beds, because they actually go out and look for the fentanyl now.
Yeah.
They're like, they don't even want the regular heroin.
Well, because it's not going to get them off.
It's not going to get them high at all.
It's not going to get them off. I mean, they want to get high.
Yeah.
And that's the thing. Everybody likes to feel high. Everybody likes to feel good.
Yeah.
Anyone who says they don't, they're lying.
Mm-hmm.
But, for addicts, it comes with a great price. It comes with consequences. And those consequences, you have to decide at some point you're not willing to pay those consequences. That's where people get sober.
Yep.
When you decide you're not willing to keep paying those consequences for that, bit of feeling that you get, and I don't know, I mean, most heroin addicts I talk to, including, when I was out there, it's like I was getting high first, right? Then I stopped getting high.
Yeah.
And I just felt I needed to keep going.
Mm-hmm.
And then if I stopped, I got sick. So then you're kind of like that prisoner in it, and you can't get out of it. And it hurts so much to stop, but you don't want to keep going.
Yep.
And that's where you end up. And then eventually, something's going to give there.
Mm-hmm.
I don't know too many old heroin addicts.
No, if I see one over 40, I tell them, like, you're exception to the rule.
Yeah.
Most don't last that long at all. That's 40 years old. That's, that's
and that's
young.
not old.
That's not old
That's
at all.
not old. I'm only 47, man. I mean, that's not old at all, I mean, it's, and I'll tell you from, I would not be here right now.
Yeah.
There's no way in hell. I mean, like I said, I stopped in 2002, April 13th to be exact.
Wow.
2002 was my clean date. And, I know, because I was 140 pounds, soaking wet.
Yeah.
I mean, I was in bad shape. People were taking bets on how long I was going to live. Good friends, right?
Yeah.
Like, people were saying, hey.
Steve's got 2 months.
Yeah, exactly. And that's the stuff that was going on. And, I didn't have any real friends at that point anyway.
Yeah.
I mean, who does?
Using buddies.
Yeah, I had people I used and people that used me. That was it. That's generally how it worked. But, you get to that point where it's like, I hit a wall, and I know that I didn't. They were probably right. I probably had about 2 months.
Yeah.
I probably had about 2 months, if that.
Yeah.
So luckily some things kind of occurred in my life. I tell people all the time, I didn't hit bottom. Bottom hit the hell out of me. Bottom smacked the shit out of me, really, is what happened. But I find that to be true for a lot of people who got sober. It's a tough game.
Yeah, and I deal with a lot of family members because I'm out there meeting with these family members, and they're trying to figure out how to fix their children. And it's very hard to tell them that there is no just fix, It's not like, hey, I'm gonna, listen, I can tell them, hey, I'm gonna send them to this beautiful place, but it's not a guarantee that they're gonna be fixed. There's
no promises.
No promises at all. It's a process. Doesn't matter how good the treatment is. It definitely helps the chances, but it's not a promise. That it's still up to the individual. To put that work into that recovery, and family members always ask me, like, what was it for you? What made you decide to change? And my exact answer is always, bottom hit me hard and I couldn't take it anymore.
Yeah.
You know, it was either die or live, you
Yeah.
know, and I chose to live, you know, and
That's it's simple, but it's you know, and that would be like a great shirt, choose to live.
yeah, that would be good.
Choose to live would be a great shirt to fight the stigma of addiction. I mean, you know, that might be something we might have to do.
Yeah,
might have to put that together, but that's, you know, like I said, it's that simple though.
Yeah.
It's that simple, but it's really complicated. You know, it's a simple program for complicated people. We hear that all the time. You know, and it's, you know, you had to come to that point. You know, you had to get there. You had to hit that bottom, or the bottom hit you, or whatever, however, and you were able to get clean, and then you turned into, you know, and a lot of people, you know, get to that point, and then they get well, and then some of them find their way into the field of helping other people.
Absolutely.
You know, and it's part of your process, right?
Yep.
And you've helped a ton of people. I know that for a fact. I mean, I know you're always out there. I know you're always on your phone. You're always, you know, trying to help somebody. If someone calls you, you're right there, which is awesome, man. I mean, that's, and I'll thank you for that, because that's a great thing. It's a great quality to have. You know, you want to make sure you're always there, because, you know, they need somebody to answer that phone.
Absolutely. You know, I really dedicated, you know, my life to this, and, you know, as you as well, you know, and you know, you were actually one of my mentors, you know,
I appreciate
coming
that.
up, and you know, I've taken a piece from everybody that's helped me along the way, and you know, I've found this really good middle ground nowadays. You know, I do work a lot. You know, I work 7 days a week. I'm you know, 24/7. My phone is always on. But, you know, I've also found ways to balance myself, you know, and I've learned that from...
That's important.
Yeah, clinical supervision. I've gotten, you know,
We've talked about that.
Yeah, plenty of
You know,
time.
that's one of the first things I say when I do clinical supervision with people is like, how are you taking care of you?
Yeah.
I don't even want to hear about anything else until you tell me how you're taking care of yourself.
Yeah, because I've seen, you know, people in this field, you know, we're still...
we're people.
We're still people
we're human.
that are in recovery.
Well, some are, some aren't.
Yeah,
I mean, and that's okay. You don't have to be in recovery to treat people, but... But, you know, we have, you know, you still have, you know, people come in, you got all your own stuff, and you're dealing with other people's stuff.
Yeah.
And you got to be able to take care of you. Your own house has to be clean before you can help somebody else.
Yeah, even if you're not in recovery, you still have to take care of yourself. You
Even
know?
people who aren't in recovery have stuff going on.
Yeah.
It's like, you know.
And then you add recovery on top of it, you know, and if you are in this field, you know, I've heard of a lot of horror shows over the years, you know, so I really heeded those warnings, you know, and took, you know, advice from supervision and stuff, and it's really worked out. I've about a year ago, or about a year and a half ago, I was really considering walking away from this field, you know, which is my passion. You know, I love this field. I love what I do. But, you know, just for some of the stuff that goes on in this industry, you know.
Could be disheartening.
Yeah, disheartening.
Very disheartening, yeah.
You know, my own personal struggles, you know, and it was just like, should I go just work from, like, Amtrak or something, you know? become an electrician. You know, why are you doing
There are
this,
people who've done that.
Yeah.
I mean, I've known people who've, you know, walked away because it's just gotten so, you know, it's hard when you're dealing with people who are going through these types of, you know, all kinds of issues, and, you know, and you see a lot. Unfortunately, we tend to see a lot more failure than we do success, and that's unfortunate. I mean, it's really, to me, it's unacceptable. I'd rather, you know, I think anybody'd rather see, you know, the success stories. But I think it's also the fact that, you know, people who don't succeed after we treat them, we end up either reading about them or they come back, and then we see them again. People who go out and be successul, a lot of times, they just go out and they you know, whatever. They change their life and they moved on, and that's all good too. You know, and I often say, you know what keeps me in this field? I get a Christmas card every year, and I've gotten it every year for probably the past 10 years from a family member of a person I treated many years ago, and it's always a picture of the whole family in all the, and, you know, all the same clothes. You know, they all have the like same sweatshirt on or whatever. It's one of those cheesy Christmas photos. But I get a Christmas card thanking me every year, and I say that's why I do what I do. That's why you keep doing this every day, because there are people that do make it. There are people that get better. You know, and that's an important fact. You know, and sometimes you could lose sight of that. When you see a lot of recidivism, you see a lot of people coming in and out. You know, and I hate the term, you know, frequent flyer. I hate that term. I don't like using it.
Me neither.
Because to me, it's like, I wasn't a first-time winner, and I'd hate somebody to put that on me.
Yeah, absolutely.
I was somebody who had to go in treatment a bunch of times before I got well.
Yeah.
And it's and it's a process. Every day you keep learning. Even even whatever, I think it's 17 years now. Even that far in, you still learn stuff every day.
Yeah.
Absolutely. I told my wife the other day, I said, you know what? I've been sober for about 17 years. This is as good as it's going to get. We were talking about something. I had said something, she'd give me a look or whatever. And I said, this is about as good as it's going to get.
Yeah.
So, but, it is what it is. I mean, we see people that do get well, and it's kind of what inspires us to keep moving on through all the other stuff.
Yeah, absolutely. That one person that comes back to you and tells you, actually, I was in the grocery store. This was about 8 months ago, and I happened to bump into somebody that I met, 3 years ago. And now, he has his family back in his life. He's invited to holidays, and he's telling me, he's has an excellent career now, and I was just blown away. And it just reminds me, why I stayed in this, and also, to kind of really get myself on the right page with understanding the faults that we do have in this industry is to understand that I don't need to be a part of them. It doesn't matter what the next person's doing or not doing, that they should be. But, as long as I'm doing what I'm supposed to do and I'm trying to help people to the best of my ability, it's going to be okay.
Yeah. You got to do your part.
Got to do my part, and I have to stop worrying about what other people are doing. So it's taken a process because I do hold this industry to a certain standard.
And we should.
Yep.
We should. There should be. We know there's been a lot of crazy stuff that's been going on in this field. Part of that has been driven by the opioid epidemic.
Yep.
Once it became very, very, as I said, you could trace this back decades, right? This isn't anything new. Matter of fact, you could trace it back to 1980.
Yeah. Yep.
And people laugh at me when I say that, but if you look, there was an article written in the New England Journal of Medicine in 1980. It might have been even 81, I don't know. But the study was from 1978, and it was written by a guy named Herschel Jick, Dr. Herschel Jick, who later regretted writing the article, but it was 100 words that changed everything. And it was, what the hell is it called? It was called Narcotics Have a Low Instance of Addiction, or Very Rare in Addiction. I think that was the name of it. And it was something to that effect. And it was 100 words that changed everything. And it basically said that, if you're using narcotics, which are opioids, you're not likely to become addicted to it. Now, of course, we know that's different now.
Yeah.
Matter of fact, it's popping up on my screen now. Herschel Jick, Addiction Rare in Patients Treated with Narcotics. That's the name. That's the name of the article. And it was 1980 Journal of Medicine. So that was a driving factor initially, right? So tell me, pharmaceutical companies grabbed a hold of that.
Yeah.
The Medical Association grabbed a hold of that. They ran with it. And then you have the creation of the fifth vital sign, right? The fifth vital sign, which is pain. Now, when you have that, the AMA is like, okay, you got to treat this.
Yep.
This is pain. Treat it.
1 to 10.
So now you have two things that are happening, right? You have addiction rare in patients, and this is a very, very well-known doctor, very good, great reputation. And like I said, he regretted writing this. And then you have, this fifth vital sign. Then you also have an aggressive pharmaceutical industry pushing pain medications. Then you have other things that have went on with certain pharmaceutical companies who have gotten sued over the last few years.
Absolutely.
And some of their executives, I think, have even went to jail for faking research or misrepresenting research. I won't say faking it, but misrepresenting it to show low signs of addiction in certain drugs.
Yeah.
And then you have, prescribe it, and you have all these medications out there. And that literally those things are the things that drove this. So I traced it all the way back to 1980. You know, I mean, it's decades ago.
And that's where it kind of
so,
it all started up, and really, it was almost a perfect storm. That we were not prepared for. We're still not prepared for it. I don't think we've seen the end of it by any means. I think we are definitely making strides to try to do what we can, but this is turning into more than just a generational thing, because now we have the kids that are being born in addictive families where both parents are heroin users, and now those kids are growing up already addicted. They're coming.
Well, they're born addicted.
Yeah, they're born addicted.
And unfortunately, the Department of Child Protection, whatever state you're in or wherever you're at, they're overworked, they're overburdened. It's not that they're bad workers. It's just, you have a lot going on.
Yeah.
And, same thing with the criminal justice system. I mean, there's just so much overflow that it's hard to do the job effectively. We see it in addictions. I mean, there's so much. So many people need treatment.
Yeah.
That you're trying to help everybody, and unfortunately, like I said, sometimes things are getting get forgotten about, or fall through the cracks, and I hate that, but unfortunately we're in an industry that's so overwhelmed in so many ways.
Yep.
In so many ways. So you got the kids, you got the families, you got the addicts, then you got the people treating them, then you got everybody else trying to be involved to try to help. And, unfortunately, a lot of them are ending up in the legal system.
Yep.
A lot of them are just ending up there. We've seen that happen with mental health, too. Mental health, when they closed down all the, they deinstitutionalized America, so to speak. When they did that, you just saw the jail systems fill up.
Yep.
They just went from one place to another. Because where are they going to go?
Yeah, absolutely.
Where are they going to go? And, it's important that, that people like you and a bunch of other people I know are in this field to try to help them figure it out. So I'm glad you're still in it. I'm glad you didn't quit.
Yeah, right.
Because, we need you.
Yeah.
We need you in it.
Thank you.
So, that being said, we also, like I said, we were talking about the opioid crisis, and one of the things that we've seen happen as a result, whenever you have desperation, you have a population that's having a difficult time. You have a population that their families are desperate. They're desperate. You have people that come out that are predatory, and we've seen that happen in this field as well. So.
Yeah, absolutely, and that it really kills me because there's people like me and you and many other professionals that we know that do it the right way. And then on the back end, then you have people that are just in it for money and trying to just make $1 million off these people suffering, and these people at their most vulnerable part of their lives. They're so vulnerable, they don't understand what's going on. They're going to listen to whoever seems like they know what they're talking about, and take that guidance, and it's the person's life that you're dealing with, and every professional should take that seriously. And if the first thing you think of when you think about your job is the paycheck at the end of the week, you should not be in this field whatsoever.
Oh yeah, no. If you're in it for a paycheck, go work at McDonald's.
Yeah.
That's. Practice. Do you want fries with that?
Yeah.
Something like that. It's not a paycheck. This is a life choice. This is a life, you're dedicating your life to help people. It doesn't end at 5 o'clock when you go home. You got to take care of yourself. There's no doubt about that. You got to have a life outside of it. Yeah. You got to put it down. You got to be able to walk away. There's days that you got to, I come home from work and I'm like, okay, I'm just going to go do, I have a healthy life outside of my job, which makes me perform better in my job.
Yeah.
Right? That makes sense. But it's not a 9 to 5. It's not a hey, you know what? I'm only available from this time to this time, because you're dealing with people's lives.
Yeah. Yep. Absolutely.
You're dealing with people that if you don't take that call, someone may die.
Yep. 3 a.m. doesn't matter. 2 a.m. You got to take that call, and get them to the right place, because mental health is a big part of this too. They may be suicidal at that moment when they're calling you. So you got to.
There's a reason they're picking up that phone. Think about how hard it is for them to pick up that phone. And there's a reason they're doing it, which is why it's become so easy for these predatory people. And not all. There's some that are out there that are doing a great job. We hear the term Florida model a lot. because it's, it's a type of therapy that's been, kind of started in Florida, and it's basically partial care with boarding, and it's kind of marketed as rehab, which is good. I mean, it's not a bad model.
Not at all.
Unfortunately, it's a really good model. I mean, but unfortunately, what has happened is there's people, Florida at one point had very, very lax regulations, and people were going from states like ours because they can work around the insurance companies somehow, right? So they go, we're in-network providers. A lot of times we're working up here. But down in Florida, a lot of them use the out-of-network insurance benefit to charge more money. And people figured that out. And then you got investment bankers and venture capitalists that got involved and said, hey, these people are basically money in the bank.
Yeah.
Let's put heads in beds. We don't care what the treatment's like. Let's do what we got to do regulatory-wise. And down in Florida, it was a perfect breeding ground for that at that time. It's actually tightened up a lot.
Yeah, big time over the last year.
Yeah, because the federal government got involved. A whole bunch of people went to jail. But there was, I don't know if you're familiar with the story of Kevin Chapman.
Yes. Absolutely.
Kevin Chapman was bringing people down there. I mean, according to the stories that I've read, was bringing people down there and putting them into prostitution, getting them hooked back on drugs, and had a whole industry going on. And he got caught because people died. And the families up here were like, wait, we were paying him. So he's paying them to treat their kids, and he's putting them out on the street as prostitutes, or Lord knows what else, and... but that's what was going on. I mean, that's how deregulatory they were down there. They weren't regulated very well. And like I said, once the federal government came in, they started locking people up. The other thing was urines, urine drug screens. They were calling it liquid gold because they would just charge, someone's inpatient treatment, they're giving them a urine drug screen every day and charging an outrageous amount of money to the insurance company for the drug screen. That was going on. I don't think that's going on as much anymore because I think a lot of people got... put in jail for fraud. So there was a whole lot of things with that going on, and it gave the Florida model a bad name.
Absolutely.
Now, like I said, I don't think it's a bad model. I think it's a really good model for some people. But, like I said, you get some people who do really bad things with it because they had the opportunity, they had the clientele, they had desperate people who are willing to pay anything. I've never met a parent who wasn't willing to cut off their right arm to get their loved one well.
Absolutely, and that's why I'm so I make sure I go to every single place that I send people to. I make sure I get my eyes on it. I talk to the clinical teams. I talk to the clinical directors, to make sure that where I'm sending them is the right place to go.
Absolutely.
Because I know what those risks are. If you send them to the wrong place and then all of a sudden they get captured in that system and you never see them again, and something happens to them or... God forbid they get put in a situation like that down there.
That's my nightmare, man.
Nightmare.
That's my nightmare. I wake up, that if there's anything that will wake me up out of a dead sleep and a cold sweat, is the thought of me sending somebody to a place like that, and that's the result. Because it's horrifying. It's horrifying that these are human beings and they're desperate human beings, and unfortunately people are capitalizing on that. And like I said, not all. I mean, there's a lot of really good treatment down in Florida too. I mean, there's good treatment in every state. But the point I'm trying to make is you got to make sure you vet it out. And that's what you're trying to say too, is that you got to vet this stuff out. I don't send people places, willy-nilly, so to speak. If you're I know which places are good, and I know which places are not. And and sooner or later, the ones that are not are going to get caught. They're going to get caught in what they're doing, and we've seen that happen. We've seen that happen here, up in this area, with a couple places that were doing things that they shouldn't have been doing. The unfortunate thing is how many people get hurt. Before they get caught
in that process.
Exactly. It's frightening. It's very frightening.
And I'm hoping, though, people are, definitely people notice it now and they know what's going on and they're being a little bit more educated about it. And I think now we're seeing this new breed of people coming out that really do want to help, and really do the right things. And I think a lot of it starts with these a few non-for-profits out there, especially in this state. I definitely have to give a shout out to City of Angels. They're excellent nonprofit. Recovery Advocates of America. They're another great nonprofit.
Yeah, two great agencies that do a lot of great things, and they don't take anything for it.
Nothing.
They just go. They're all volunteer, and they're all donations, right?
Yep.
And they're basically, tell us a little bit about those agencies and what they do, because I think people don't know, and I think it's important that they do.
So that's where I got my start in this industry. I came home. I was away for 3 years. I came home. I didn't even own a wallet.
You went on vacation for 3 years?
I went on vacation. Right? For 3 years. They used to call it in my family because I'm Italian. They say, "Oh, you went away to college." You went upstate to college.
That's great. That's great.
But I came home and. I didn't own anything, and they were willing to really help me out.
Okay.
They put me up in a sober house. They started helping me work towards a degree and all kinds of stuff like that. Helped me get job opportunities. And then I eventually got my first job in the industry. With Carrier, and it was just it was they really it was that perfect back end and front end of what I needed. I was lost. And
made you well-rounded.
And they guided me.
Yeah.
And that's what they're really about. They have recovery coaches. They're help guiding people. They do interventions. They have a set of funds where they'll help with sober living. The person does have to complete a full continuum of treatment, which makes complete sense. But they're truly there, and everybody that works with these agencies really have the patient's best interest at heart.
Well, they're volunteers. They're not making anything off of it. They're basically just there to help people. They're keeping what they have by giving it away.
Absolutely.
Right. So.
Yep. And and it's such a good mixture of people, because you have people that are in recovery that volunteer. You got the family members that volunteer. City of Angels has a humongous. A lot of our volunteers are family members. And it's so cool because that a lot of them, maybe they lost their son or daughter, and now they just want to help
somebody else. They don't want it to be, they don't want it to be for nothing. Yeah. Right. I mean, that's. We've had many donations. We even have at the place that I work that you work there too still. Yeah. We have a big mural that was painted by, I can't remember what year it was, but it was several years ago. That was it was donated by a family that lost their child, and their child had been with us many times, and just couldn't, unfortunately, make that change. Yeah. And they wanted to donate something back, and they did. They donated the wall and a tree outside, and we always try to help people process that when it's a tough thing. I can't even imagine losing a child.
It's the most unbearable thing I could think. Kevin Mira, which is he was one of the ones that started City of Angels. His son, I knew his son really well. We grew up together. And we were both doing the same stuff, and he didn't make it. And instead of Kevin just imploding, and he told me the only way he could describe what the pain was he would take a shower and the water felt like pins and needles going into his head. The pain was so tough for him. But he went around and then took, I think it was $1,000 out of the KC fund that he had for his son. His name was Casey, and took $1,000 and put it towards City of Angels, and a bunch of like-minded people got together and tried to figure out how the system worked or didn't work. We found out more that it doesn't work. It didn't work very well.
Yeah, there's some broken parts to the system. Yeah,
some broken
no
parts.
doubt.
But that agency has helped. Nonprofits help. Thousands and thousands of people now, and
outreach is super important, man. That's so important to, it's not just waiting for the person to make the call. It's, capitalizing on the person's motivation when they're ready.
Absolutely.
And that's sometimes you got to let them. They make a call and they leave a message, and then you got to keep calling them back, right?
Absolutely.
And kind of say, hey, we're here for you. When you're ready, we're here for you.
Yep.
You can't force anybody into treatment. I mean, that's one of the things I get all the time with family members. And,
Can you lock them up?
Yeah, make them stay there. It's like, I can't. They're an adult. I wish I could. I would gladly try to figure out a way to do that. I mean, I'll talk to a person. I'll talk to them till they, sometimes I'll talk to them for, forever till they decide they want to stay. But sometimes it doesn't work out. I mean, sometimes they decide they got to go back out. Or that's never what they tell us, generally. It's, they're like, I got to go do this. I got to, they put a bunch of priorities out there.
I could get my oil changed.
Yeah, my car is, it's, they give me a whole bunch of different things. And you know what? I mean, and I kind of just say, look, man, if you want to go use, just tell me you want to go use. That's just be honest. At least we could start there and talk there. And if you don't want to stay at the end of the day, it's up to you. You can go.
Yep.
And that's, we call that, when people, want to take off, that's called against medical or against clinical advice, and they leave treatment. And, hopefully, what I usually say to those people, if they've made their mind up and they don't want to stay, is I hope you make it back.
Yep, absolutely.
Is generally the, the best thing that can happen when someone walks away from treatment or a person starts using it. I say this all the time. I use this line all the time with everybody. Is the best thing that can happen if you start using again is that you end up back here. Yeah. That's the best way it could possibly end.
Yeah, yep, absolutely.
So think about that before you walk out the front door.
Yeah.
And like I said, some people just aren't ready yet, and they have to go out and do more research.
Or they digress, maybe they had recovery, and I'm actually dealing with this with one of my really good friends, we grew up together, and he had about 3 years, we were doing really well, and he just digressed tremendously, where back into the denial, back into the,
That's not just a river in Egypt?
Yeah. Just not understanding, like, oh man, like, this is what's going to happen if I continue to use. I'm going to be homeless or in jail or dead, and that's the honest truth of it, and really it's our job to, and what I feel is all I could do is present them with all the other avenues out, and hope they take it, and take the advice.
Yeah, present the options. Yep. I mean, here are your options. Here's what I see. I always counsel the people who work for me. I always say, offer your opinion after you ask permission. Is it okay if I give you some of my thoughts? And generally people will say yeah. Yeah. And, then you say, look, here's what I see. Here's what I see happening. And, what do you think about that? Can you tell me a little bit about that? It's a part of a tactic I use in treatment called motivational interviewing. It's how we resolve that ambivalence. Because addicts want two things at the same time, right? They want to be clean. I mean, I've never met an addict who didn't come into treatment that didn't some way want to be clean.
Yeah, absolutely.
But they also want to keep their lifestyle.
Yeah.
They also want to keep going. They also want to keep hanging out with the same people. They still want to be able to figure out a way to use successfully. Yep. But they want to have a nice house. They want to have a nice job. They want to have their family happy with them. They all want that stuff. Yeah. But they want two things that don't work at the same time.
Yeah. Yep.
Together. And that's what we call ambivalence, and that's what you have to resolve. And the best way to do that we've found is working with motivational interviewing and using the tactics provided there. And sometimes that just means being with the person and listening to them. Actually hearing them, building up, accurate empathy to their situation, understanding it from their perspective. And that's not always a, real intuitive or old school. When I went to treatment years ago, it was basically this, So what makes you want to come in here? This was the, what brings you in here today? And you'd tell the person, and they're like, you'd say, oh, I'm doing drugs, blah, blah, blah. Well, you need to stop that. And I'm like,
knock that off.
Okay, well, and that was and then be like, well, I don't know, I don't really want to be here. Well, then don't, come back when you're ready. That was what therapy used to be with addiction.
Absolutely.
It's very different now. I mean, we know that doesn't work. All that does is push people out the door, and most of them won't make it back.
Yeah.
You can't be confrontational right off the bat. Confrontational is still useful in therapy. However, you make the patient confront themselves.
Yeah.
And that's what motivational interviewing is built on. Motivational interviewing is built on having the patient confront themselves.
That's great.
And you leading them in that way. And it's, I've trained you in that. I've trained a lot of people in that. And it's just in my opinion, probably one of the best ways to make people find that intrinsic motivation.
And I use that to this day, when I'm just actually the initial phone calls that I take, they might be reaching out, and I really get them to really talk about that. I always assess their level of motivation by asking them, like, what do you want to do? what is your
what's your goal?
What's your goal? Like,
Yeah.
where do you see yourself? What makes you want to make this change? Instead of saying, oh, good, yeah, you need to go. This is what we're doing. And I always like, what's that motivation?
I really want to understand where you're coming from. That's one of the best ways to kind of get people to open up. Help me understand, because I want to get this. I want to make sure I get it right.
Yeah.
I've said that to clients a bunch of times, and it's really important. And it makes them feel a couple things. It makes them feel like you actually want to hear what they have to say, because a lot of people have shut them down. What they say is important, and you're struggling to figure out their point of view, and that's important. It's all important stuff. So really good stuff. Is there anything else? Did we miss anything? I don't know.
I don't think we did. I don't know. Last thing I would just really like to say is, there is hope out there, and there, and as long as people continue to fight towards this, to a solution to this epidemic, I think little by little we're crushing the stigma. From even when I first got into this field, it was kind of, oh, that's what you do for a living. Now people are actually hear about it, or they'll say, yeah, I have a family member that's going through it, or this is what's going on, and they'll really, the stigma is starting to dissipate a little bit at a time. We just got to keep fighting, keep advocating for the people that can't advocate for themselves, and do it the right way. Yeah,
no, we're breaking the stigma, man, slowly but surely, and hopefully we'll be able to do it, and come up with new methods to treat people and help people and be able to treat a wider range of people. There's a lot of people out there that don't get help that should. For anybody who doesn't, there's a ton of help out there. Please, whatever state you're in, wherever you're at, whatever country you're in, it doesn't matter. Don't give up hope. There is hope after dope. People get clean, people get sober, but they don't do it without help. So get a number, find a number. You could comment here. Subscribe to this. Subscribe to the podcast. Extreme Life is not always about this particular topic, but this is a topic that's near and dear to my heart, which I really am glad we finally got to be able to do this podcast, because it is important. It's an important topic to address, and like I said, I think it's we're on our way to figuring some things out, but we still got a long way to go. Until we could treat this disease effectively, where it's there is nobody suffering with it anymore. That's generally where we want to go. Now that's a lofty goal, but I think it's really important, and it's eventually going to be attainable.
Absolutely.
So,
and and I if you don't mind, I could give my contact. I can be reached 24/7 at 609-433-8759, and that phone is always on. You could always reach out. I'm always here to help, and I'll find any way I can to get you to the place you need to go.
Awesome. Well, you're a brave man putting your phone number out there.
It's my phone. That's it's my personal and work phone. But hey, it's what it is. What it is.
All right. You're a brave man. Don't prank them too much.
Yeah, no pranks.
Anyway, thank you for watching the podcast and listening. If you're listening to it, thank you for listening to it. And we'll be back. We're going to be doing a lot more with addictions too. Like I said, we're not always going to be doing this particular topic, but it is going to be a focus. This is part of XTREMELIFE.com, but we're going to call this the Addiction Chronicles, and we're going to basically talk about this topic until we figure out what to do with it. All right, I appreciate your time. Thank you for listening.